Hi, this is Dr. Homer Lim, and you're listening to your Holistic Health Podcast. Good afternoon, guys. Welcome back again for our weekly talk here at Akesis Holistic Health. So this afternoon, we'll be discussing about what we call Polycystic Ovarian Syndrome, or what we call PCOS. Now, so this is very, very common now. A lot of young women now have this syndrome called Polycystic Ovarian Syndrome, which is PCOS. No, so if you would read, a lot of people would be, a lot of websites would say that, there's no known reason why we would have, why a lot of women would have PCOS. I think this is the main thing that we have to discuss with regards to the cause, no? But before we go there, we kind of give you a small introduction of, what are the symptoms or what are the things that are associated with PCOS, no? So a lot of women with PCOS, no, would have a longer or if not absent menstrual cycle. So some women with PCOS would have, menstruation sometimes 3 or 4 months, some 6 months. So some would be having, menstrual cycle for only twice a year. So this is not, healthy, So especially among women who are, a bit on the heavy side, those who are obese. So usually they would have some form of polycystic ovarian syndrome. So aside from having a prolonged or absent menstruation, a lot of them would have problems with sugar. So they would have high blood sugar, or what we call some form of insulin resistance. Some of them also would complain of hirsutism. Hirsutism means you have a bit of hair that you only, normally see among, boys or men. Sometimes they would have parang a bit of a mustache or a bit of and who have been diagnosed with PCOS, and later on they want to get children. They get married, then they want to have children. Then they because of the PCOS, they have what we call, becoming infertile because they cannot have a good regular menstrual cycle. Therefore, there's no regular ovulation as what you see in women who don't have. So those women who do develop what we call PCOS or Polycystic Ovarian Syndrome, there's a hormonal problem or hormonal imbalance. A lot of studies showing that women with PCOS actually have an overproduction, okay? Not just, I would say, not overproduction, but overstimulation of their what we call estrogen receptors, okay? So why would I say overstimulation rather than overproduction? Because in our environment now, we have so many chemicals or toxins that are, in the environment that we are exposed to. So examples of pesticides or petrochemicals, they can have an estrogenic effect. Estrogenic effect meaning when they go into the body, they stimulate the estrogen receptors of the cells, no? So that's what we call we call it Xenoestrogen. So this Xenoestrogen can actually stimulate your ovaries. So because of that overstimulation, then you might develop what you call some form of polycystic ovaries, or the ovaries have multiple cysts. So that's what you usually see when you do an ultrasound of the ovaries. They have multiple cysts in the ovaries, which is not normal, no? So that, number one, that's one of the things that is not being looked into, the effect of what we call pollutants or toxins in the environment that can cause what we call polycystic ovarian syndrome, okay? So aside from too much estrogen stimulation, there's also what we call stimulation of some of them would have high testosterone. Not all women, but some women would have high testosterone. So if they would have high testosterone, that's where you see they have hair on their hair on the face, no, or too much hair on the arms and legs. So some of them would also have high insulin meaning even though they have very high insulin, the body is still unable to process sugar. So they have high insulin and at the same time high blood sugar. So this means that they have some form of insulin resistance. So we see a lot of women who have what we call PCOS. They do need some intervention hormonally, not just in their diet, So other things so I think what we have to address aside from the diet is we have to address also the hormonal imbalance, which sometimes, diet alone may not be enough. A lot of women who are, on big, when they're big, they're a bit overweight, and people, you get, some of them would get judged being fat. You should avoid eating sweet, avoid eating carbs. And yet, even though they do this, they're not losing weight. So it's not their fault. It's because the hormones is acting, a bit strange or out of balance or out of whack. So, because a lot of women with PCOS also, which is not being addressed properly, is they also have what we call thyroid issues. So women with PCOS would also have some form of hypothyroidism. So that's why they're also a bit on the heavy side. So I think we have to address that. Not only their PCOS, we have to also address their thyroid issues. We also have to address their diet, the type of food that they're eating. So when at the clinic, so when we do see them, we always get a blood test, not just an ultrasound. Because normally what, doctors would do, they just give a birth control pills and, wait for maybe 6 months, try to remove the pills, see if your hormonal imbalance will be resolved, no? But, that's not, that's not the proper way, just giving pills, and just wait 6 months. I think what we need to do is we need to look at it at a multi-pronged way, which is we address the hormones, not just the hormonal imbalance in estrogen, progesterone. We also adjust and see if there are problems with their thyroid hormones, okay? And then we also address their sugar problems, okay? So with these three things, if we can address it properly, then women would start, women with PCOS would, start having a more regular menstrual cycle, no? And then they would start losing weight, especially if those women who are hypothyroid and they are also having PCOS, you correct those hormonal deficiencies, they start actually losing weight, which is one of the things that we look into, or, give us an idea that we're actually correcting the hormonal imbalance. So in women who have PCOS, we usually would request, again, a thyroid panel, hormonal balance, estradiol, their progesterone, and then in ultrasound, just to see how we're looking, how the body is handling the problem. No? So a lot of women also would complain of acne. So one of the things also with women is acne, which is, again, that's part of the testosterone imbalance that we find in women with PCOS. So a lot of people are not aware, but young women are not aware that actually they have PCOS, and even though their menstrual cycle sometimes is regular, yet when you check them, you see that they would still have what we call polycystic ovaries, which is, we, as much as possible, want to correct it as early, because at the latter part of their life, when they want to have children, it becomes a problem. So we have to correct that hormonal imbalance as soon as we do detect it, so it won't be hard for them when one day they decide to have children. So we give a bit of herbs also to women who might have this issue. So we give what we call herbal remedies that would address their sugar, like berberine, like dipinitol. So dipinitol is probably a newer herbal supplement that actually helps not only with blood sugar, but actually helps with hormonal imbalance among women with PCOS. So other than that, we also can correct the thyroid. So a lot of women with thyroid hypothyroidism, you can give a bit of iodine or kelp. The iodine actually helps in shrinking cysts, whether it's breast ovarian cysts actually can help shrink those cysts. So kelp, iodine, if they do need more thyroid support, then we might have to give some thyroid hormone. We might have to give what we call bioidentical estradiol or estrogen and bioidentical progesterone, because in women who, especially those who have literally no menstrual cycle, or their menstrual cycles every 3-4 months, then definitely we need to to correct that hormonal imbalance, because it's really not healthy. I mean, I know some women, they hate having a menstrual cycle, but it's part of the, it's part of trying to balance the body. So if you can do if the body or the woman's cycle is regular, then their reproductive system is actually healthier, no? Because then the endometrial lining gets renewed and replaced every month. That would be a very healthy way for women, because in women who don't have a regular menstrual cycle, their endometrial lining becomes thinner. So in women in later part of the years who have PCOS might develop some form of cancer, whether it's endometrial or cervical cancer. So we really have to make sure that we correct the hormonal imbalance. So can acupuncture help PCOS? Definitely, especially among women who have irregular menstrual cycles. So we do acupuncture to help regulate their menstrual cycle. No? We do see a bit of women who come for treatment not because of PCOS, but later on finding out it's because of their PCOS that's causing all of this, multitude of problems. That's why we have to correct that hormonal issue, and eventually they are the ones going to be happy, because their menstrual cycle becomes regular, their weight becomes manageable, they don't have a hard time trying to go on a yo-yo diet or some form of crazy diet trying to lose weight. But they always fail because of, again, the hormonal imbalance. We always have to correct the hormonal imbalance. Okay? Thank you for listening to your Holistic Health Podcast. This is Dr. Homer Lim. Now, if you do have questions about your health, or you would like to request topics for our next podcast, please do message us at our FB page or Instagram at Akesis Holistic Health, or you may visit our website at www.akesisholistic.com. Thank you again, and please do come back for our next episodes.